Food-drug interactions, a delicate balance. Certain foods can profoundly impact the effectiveness and safety of medications. From grapefruit to garlic, understanding these food-drug interactions is crucial for patients to ensure they get the most out of their treatments without risking unintended consequences. When food and drugs don't mix, grapefruit, blood thinners. Grapefruit can interfere with the metabolism of some blood thinners, leading to dangerously high drug levels and increased risk of bleeding. Dairy, antibiotics. Calcium in dairy products can bind to certain antibiotics, reducing their absorption and effectiveness. Leafy greens, blood thinners. Vitamin K in leafy greens can counteract the effects of blood thinners like warfarin, putting patients at risk of clotting. Alcohol. Medications. Drinking alcohol while taking certain medications can cause drowsiness, dizziness, and other dangerous side effects. Antibiotics and dairy. Understanding the interaction. Consuming milk and dairy products while taking antibiotics can reduce the effectiveness of the medication. This is because the calcium found in dairy can interfere with the body's absorption of certain antibiotics. Calcium, iron, and your diet. Calcium and iron are both essential nutrients, but they can interfere with each other's absorption in the body. It's important to be mindful of when you consume calcium-rich and iron-rich foods to get the full nutritional benefits. Timing matters for calcium and iron. Calcium and meat. Calcium in dairy products can inhibit iron absorption from meat and meat products. Iron supplements. Allow 1.5 to 2 hours between taking iron supplements and consuming calcium-rich foods. Tannins in tea/coffee. Tannins found in tea and coffee can also interfere with iron absorption. Getting the most from your nutrients. Separate calcium and iron. Consume calcium-rich and iron-rich foods at different times of the day. Consider vitamin C. Vitamin C can enhance iron absorption, so pair iron-rich foods with citrus or other vitamin C-rich items. Enhance iron absorption. Cooking in a cast iron pan can also help increase the amount of iron in your food. Food-drug interactions. Many common foods can have significant interactions with prescription medications, either enhancing or reducing their effects. It's crucial for patients to be aware of these potential interactions to ensure the safe and effective use of their medicines. Common food-drug interactions and their effects. Grapefruit. Grapefruit and grapefruit juice can increase the absorption of certain medications, leading to increased drug levels and potential side effects. Dairy products. Calcium-rich foods like milk, cheese, and yogurt can interfere with the absorption of some antibiotics and osteoporosis medications. Leafy greens. Vitamin K-rich foods like spinach and kale can reduce the effectiveness of blood thinners, putting patients at risk of clotting or bleeding. Tips for safe consumption of medications and foods. Read labels carefully. Carefully review the information on medication labels and consult with your healthcare provider or pharmacist about potential food interactions. Timing is key. Take medications as directed, either with or without food, to ensure proper absorption and effectiveness. Communication is crucial. Inform your healthcare provider about all the foods, supplements, and other medications you are taking to avoid potentially harmful interactions. Moderation is recommended. Avoid consuming large amounts of any food that may interact with your medications, and try to maintain a balanced, healthy diet. Common food-drug interactions and their effects. Grapefruit. Grapefruit and grapefruit juice can increase the absorption of certain medications, leading to increased drug levels and potential side effects. Dairy products. Calcium-rich foods like milk, cheese, and yogurt can interfere with the absorption of some antibiotics and osteoporosis medications. Leafy greens. Vitamin K-rich foods like spinach and kale can reduce the effectiveness of blood thinners, putting patients at risk of clotting or bleeding. Maximizing iron absorption. Navigating meat, dairy, and supplements. While meat and meat products are excellent sources of iron, the calcium found in dairy products can inhibit iron absorption when consumed together. It's important to time the consumption of calcium-rich foods and iron supplements to ensure optimal nutrient absorption. Timing is key for iron and calcium. 1. Calcium-rich foods. Dairy products like yogurt, cheese, and milk contain calcium that can interfere with iron absorption. 2. Iron supplements. Taking iron medications can also be affected by the presence of calcium in the digestive system. 3. Wait 1.5 to 2 hours to ensure maximum iron absorption. It's recommended to wait 1.5 to 2 hours between consuming calcium-rich foods and taking iron supplements. Balancing meat, dairy, and iron supplements. Meat and meat products, excellent sources of iron, but the calcium in dairy can inhibit absorption when consumed together. Dairy products provide essential calcium, but this mineral can interfere with the body's ability to absorb iron from meat and supplements. Iron supplements, helpful for meeting iron needs, but timing is crucial to avoid interference from calcium-rich foods. Diuretic drugs and potassium-rich foods. Some diuretic drugs used to treat hypertension can affect potassium levels. Certain medications increase potassium levels while others deplete it. A healthcare professional can determine if a dietary change is necessary. Potassium-rich foods to limit when taking diuretic drugs. Bananas. Bananas are rich in potassium. Consult with your doctor before limiting potassium-rich foods. Potatoes. Potatoes are a common source of potassium. It's important to follow your healthcare professional's guidance regarding dietary adjustments. Apricots. Apricots are rich in potassium. It's crucial to consult with your healthcare provider for personalized advice on potassium intake. Avocado. Avocados are known for their potassium content. It's recommended to seek professional guidance for dietary modifications. Consulting with your doctor about your medication and dietary needs. Medication review. Discuss with your doctor the type of diuretic drug you're taking and its impact on potassium levels. Dietary assessment. Inform your doctor about your typical diet and potassium intake. This helps in customizing dietary advice. Personalized recommendations. Your doctor can provide specific recommendations for potassium intake based on your medication and health status. Grapefruit interactions. Antibiotics and allergy medications. Grapefruit can interact with certain medications, potentially leading to unintended consequences. This interaction can occur with antibiotics and allergy medications, potentially causing unexpected effects and even increasing medication levels in the body. Green leafy vegetables and blood thinners. Some blood thinners can be affected by the consumption of vitamin K-rich foods, including leafy greens. This is because vitamin K plays a crucial role in blood clotting, and its presence can counteract the effects of these medications. Importance of vitamin K. Vitamin K is essential for proper blood clotting, which helps prevent excessive bleeding. This process is crucial for maintaining overall health and preventing serious complications. Wound healing. Vitamin K helps form blood clots to stop bleeding from wounds, promoting faster healing. Bone health. It contributes to the production of proteins that support bone health and density. Cardiovascular health. Vitamin K is involved in regulating the calcium levels in the body, potentially impacting heart health. Foods high in vitamin K. Many foods naturally contain vitamin K. These can be incorporated into your diet to ensure adequate intake. It's important to maintain a balanced approach, considering both the benefits and potential interactions. Green leafy vegetables, spinach, kale, collard greens, turnip greens, mustard greens, and Swiss chard are excellent sources of vitamin K. Cruciferous vegetables, broccoli, Brussels sprouts, cauliflower, and cabbage offer a good amount of vitamin K. Other sources: liver, eggs, And some cheeses also contain vitamin K. Interaction between vitamin K-rich foods and blood thinners. The interaction between vitamin K and blood thinners can be complex. It's essential to understand this relationship to ensure optimal medication effectiveness. How it works: vitamin K helps your blood clot properly. Some blood thinners work by blocking the action of vitamin K. The impact: a sudden increase in vitamin K intake can reduce the effectiveness of blood thinners, making blood clots more likely. Consistency is key. Maintaining a consistent intake of vitamin K helps prevent unpredictable fluctuations in blood clotting. Potential impact on blood thinning effect. Consuming vitamin K-rich foods while taking blood thinners can have various effects on the blood thinning effect. It's important to be aware of the potential consequences and consult your doctor. Reduced effectiveness. Increased vitamin K intake can reduce the effectiveness of blood thinners. Increased risk of clots. Reduced blood thinning can lead to an increased risk of blood clots. Unpredictable effects. Fluctuations in vitamin K intake can make it difficult to manage blood thinning. Importance of consistent vitamin K intake. While high vitamin K intake can interfere with blood thinners, it's also important to maintain adequate levels for overall health. Consistent intake helps maintain a stable blood clotting balance. Fluctuating intake can lead to unpredictable changes in blood clotting. Low intake may increase the effectiveness of blood thinners, potentially increasing the risk of bleeding. Monitoring dietary changes with blood thinners. Regularly monitoring your diet and vitamin K intake is crucial when taking blood thinners. It's important to be mindful of the foods you eat and consult with your healthcare provider. Food diary. Keeping a record of your daily food intake can help identify potential issues. Regular checkups. Regular blood tests can monitor the effectiveness of your blood thinners. Open communication. Communicate any dietary changes or concerns with your healthcare provider. Consulting with healthcare providers. It's always best to consult with your healthcare provider before making significant dietary changes when taking blood thinners. They can provide personalized advice and ensure your safety. Assessment. Your doctor can assess your individual needs and recommend the appropriate course of action. Recommendations. They can provide specific dietary recommendations based on your medications and health condition. Monitoring. They can monitor your progress and adjust your treatment plan as needed. Antidepressants and dietary restrictions. Certain antidepressants can interact with tyramine-rich foods, potentially leading to adverse effects. It's essential to consult with your doctor about dietary restrictions when starting antidepressants. Potential interactions with tyramine-rich foods. Tyramine. Tyramine is an amino acid found in certain foods, such as aged cheese, fermented foods, and some meats. MOIs, monoamine oxidase inhibitors, MOIs, are a type of antidepressant that can interact with tyramine. Hypertensive crisis. Consuming tyramine-rich foods while on MOIs can cause a sudden and dangerous increase in blood pressure. Symptoms. Symptoms of a hypertensive crisis include headache, sweating, and rapid heartbeat. Bronchodilator medications and dietary considerations. Bronchodilator medications are essential for managing respiratory conditions by relaxing airway muscles. However, it's crucial to be aware of potential interactions with certain foods and beverages. Caution with stimulants. Bronchodilators can interact with stimulants, including caffeine and theobromine found in chocolate. These interactions can lead to undesirable side effects. Increased heart rate. Stimulants can exacerbate the effects of bronchodilators, leading to an elevated heart rate, nervousness, and irritability. Combining these substances can heighten feelings of anxiety and restlessness. Headaches. The combined effects of stimulants and bronchodilators can trigger headaches, nausea, and vomiting. In some cases, the combination can cause nausea and vomiting. Understanding interactions, it's essential to discuss potential interactions with your healthcare provider. They can advise on safe dosages and provide guidance on managing these effects: food/drink, stimulant, potential interaction, black tea, caffeine, increased heart rate, nervousness, green tea, caffeine, increased heart rate, nervousness, coffee, caffeine, increased heart rate, nervousness, chocolate, theobromine, headaches, nausea, increased heart rate.
If you would like to contribute to the development and growth of our health channel, you can press the like button, comment, and subscribe. Thanks for watching.